Anatomy of the eye. The outermost fibrous layer, anterior 1/6 is the cornea and the posterior 5/6 is the sclera. Middle we have the intermediate vascular core formed by the iris and the ciliary body. Ciliary body has the pars pliccata, which is 2 mm in length, and we have the pars plana foramen. Pars pliccata gives off zonules and a suspensor lens. The optic nerve coming inside the eye will give off a nervous layer, which is the retina, which comes off, and here we have a dentate process around this area. This is called the ora serrata. Anterior chamber bounded by the cornea, the part of the iris, part of the ciliary body, and part of the pupillary area and the lens. Aqueous humor will drain through the angle of AC. Posterior chamber is triangular. Together both chambers form the anterior segment, and then we have the posterior segment behind the lens. Posterior segment refers to the vitreous humor, the retina, choroid, optic nerve, aqueous humor, vitreous humor. Blood supply, we have the internal carotid artery. One of its branches is the ophthalmic artery. Gives off a lacrimal artery which goes to the gland. Gives a central retinal artery which will supply the retina. It gives off around 10 to 20 short posterior ciliary arteries which will supply the uvea. Gives off 2 long posterior ciliary arteries. Reach the ciliary muscle and form the major arterial circle of the iris, and then here they will supply the ciliary muscle and the iris. Also, the short posterior ciliary arteries are entering in a ring around the optic nerve. They pierce the sclera, enter the uvea, and give rise to the intrascleral circle of Zinn. And ultimately, they will end as the choriocapillaris, which will supply the entire choroid, posterior part of it. Anterior part of the choroid, is the iris and the ciliary processes, which was supplied by the long posterior ciliary arteries. Also, central retinal artery was supplying the inner layers of the retina, and the outer layers of the retina are supplied by the choriocapillaris, which we know comes from the intrascleral circle of Zinn, which was from SPCA. And finally, the ophthalmic arteries also give out the muscular arteries, which supply our rectus muscles. Now, venous drainage. Inner retina drains into the central retinal vein. Then you have the short posterior ciliary veins, which receive blood from the sclera. Then we have 4 vortex veins around the eye. So we have the superior nasal, the inferior nasal, the superior temporal, and the inferior temporal. They receive blood from the uvea. Now, all 3 of these groups will drain into the superior ophthalmic vein, and this will also drain into the inferior ophthalmic vein. And from there, they go into the cavernous sinuses. From there, it goes into the IJV. An internal jugular vein exits the skull. Now, nerve supply. Sensations from the lacrimal gland and the tissue of the eye. They're going to be taken up by all these nerves. Pass through nasociliary, frontal, and lacrimal nerves. Altogether taken by ophthalmic nerves, the first branch of the trigeminal. That was sensory. What about motor? So apart from SO4 and LR6, all other extrinsic muscles are supplied by the oculomotor nerve. Apart from the extrinsic muscles, the oculomotor nerve also supplies your levator palpebrae superioris, which is your upper eyelid muscle, and we also have the ciliary ganglion. The ciliary ganglion receives 3 inputs. Major sensory input from the tissue of the eye was going to the trigeminal ganglion, but the nasociliary also gives off a sensory route to the ciliary ganglion. So first input is sensory innervation for the eyeball. Second is from T1, T2, that is the superior cervical ganglion, which sends off a sympathetic route to the dilator muscle for mydriasis in cases of sympathetic stimulation. Goes via the short ciliary nerves after the ciliary ganglion. Third input is the oculomotor nerve, which gives off the parasympathetic innervation, which goes via the short ciliary nerves again after the ciliary ganglion and goes to the sphincter pupillae and the ciliary muscle. The sphincter pupillae and the ciliary muscle, which are going to cause constriction or miosis in cases of parasympathetic stimulation. Also, quick anatomy of the layers of the retina. Light falls, goes to the pigment cell layer. We have photoreceptors, the rods and cones. Unka nuclei या cell bodies form the outer nuclear layer. They synapse through the outer plexiform layer with the inner nuclear. Inner nuclear layer contains the bipolar, horizontal, and amacrine cells. Synapses with the ganglion cells, which give out optic nerve fibers and form the optic nerve. Carries vision to cortex.